This is LiveWell Talk on new Clinician Spotlight. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital. Today's episode is another installment in a series on the podcast where we sit down with new clinicians at UnityPoint Health and get to know them as a clinician and as a person. Our guest on today's episode is Jessica Thomas, a physician's assistant with UnityPoint Clinic Family Medicine, Hiawatha. Jessica, welcome.
Thank you.
Now, how long have you been with the clinic out there?
So I started here in February of this year.
Yeah. I mean, it's not like you're a total newbie.
No, so a little over 6 months or so now. Mm-hmm.
Well, where are you from? Tell us a little bit about yourself, your background.
Yeah. So I'm actually from Marion.
Okay.
I grew up there, went to school at Marion High School. When I graduated from there, I left and, went through all my different years of schooling, and then I spent the last 5 years down in southeastern Iowa in Mount Pleasant.
Mount Pleasant?
Yep, right. Okay. That's where I started my practice after I graduated PA school, and then kind of decided it was time to come back home.
Get closer to home.
Mm-hmm.
Well, that's awesome. Where'd you do your PA training at school?
I went to Des Moines University for my PA.
Okay.
Yep.
So Des Moines University, that's a 2-year program, right?
Yeah, I think it's technically just over 2 years, if I remember right.
Okay.
Yep.
Yeah, with both clinical and...
Yeah, you have the full year of didactic. I think it's 14 months of didactic and then 12 of
the rest
clinical.
Of time. Yep. Okay, yeah, that's great training. I'm always impressed with physician's assistants when they come in and are so well trained and they got good experience and really focused on what they need to do. Where'd you say you went to undergrad at?
I went to St. Ambrose University in Davenport.
St. Ambrose,
yeah.
which now they have a PA program.
They do. It was one of the ones I considered. Well, they had just started the program a few years before I went there.
I think about 10 years ago, somewhere in there.
Yes, because I think they were in their second or third class when I would have been going. Yeah. And honestly, I thought about it, but I'd spent 4 years in Davenport, and I kind of wanted to try something new. So Des Moines is where I went. Yeah.
Is there a particular clinical interest you have?
Probably my biggest clinical interest is going to be preventative care to start with. Very big on making sure that people get in for their yearly exams and things that we can do to help you, to prevent you from having more medical problems down the road. And then, other interest for me is going to be pediatrics and women's health.
But you're comfortable with the full spectrum of care, yes. Pediatrics, infants, all the way up to
yes,
geriatrics. Absolutely.
Everything from birth to death is what I always say, which is the best part about family medicine and seeing every walk of life and stage of life.
We talk about on the podcast, people have, it's what they do, it's how they do it, but really the why. Why do you do it? And other podcasts, we've talked about how that why is such a gift. To be able to know what your why is. What's your why?
Yeah. For me, I think throughout our careers, we have different whys. The reason that we first chose this career versus why we're still doing it 5 or 10 years later can be different.
I still don't know what I'm going to do when I grow up, so don't feel bad.
I think most recently, my biggest why and why, that I find myself reflecting on is getting to be the provider that I wish I had. Growing up or at different times throughout my life, if I had a specific issue, and maybe I didn't have somebody established or I wasn't comfortable with who I did or something, maybe I didn't bring up that issue because I was nervous about it. And so getting to have a patient in my office that brings this up and talks about it openly with me, or when they'll say oh, thank you for understanding or what, it's that's why I want to do it because I want to be that person that maybe wasn't always there for me when I was younger.
That's a great answer. What would you tell patients that you want them to know about you before they sit down in that exam room?
Yeah. My practice style is very collaborative. I am not the type of provider that's going to sit here and tell you to do X, Y, and Z. My visits are going to be mostly us talking for the first section of time. I want to know all the information. And then I'm going to lay out what our different options are for you. I will let you know if there's maybe one that I think might be a little bit better and why I think that one's better. But at the end of the day, you're always going to have options before you leave my clinic, and you're going to be the one to determine which one of those is what you want to do moving forward.
Yeah. I mean, some people use the analogy, you're like a waiter in a restaurant. You'll say, here's the specials, here's what I think would work for you, here's what I would avoid.
Yeah.
But ultimately, the patient makes the decision.
Exactly. And I want you to be as well educated on those options as you can. I always tell people that my job is to bring up all the things that are available to you. If you choose to not do them, that is completely fine.
Right.
My job is to bring it up and to make sure you don't have any questions about it.
Well, that being said, so you're able to balance more of a fraternal sort of relationship with your patients than a paternal. I mean, you don't.
Yeah.
Because I think some patients want the fraternal. There's other patients just tell me what I got to do.
Yes.
I don't want to talk about it. Just give me the
absolutely
medicine and
Which is why I always tell my patients, especially if they're moving or they're changing, we're people too. We have personalities. We have ways that we practice. And so it's important to find the one that practices like you, that you want. And so that's why, I think that's a really important thing for somebody to know about me is that it is going to be a discussion. We're going to talk about it. You're going to have a say in it. So if you're looking for somebody to tell you exactly what to do, I'm probably not the right fit for you. And there's nothing wrong with that either.
Right. Well, and as you practice, looking back, you'll learn what's important. You don't really, you might think you know what's important right now, but 25 years from now, you'll say, this is what is important.
It changes every year.
It does. And if it doesn't change, then you're really missing out on that experience of having a medical practice and a medical career.
And I think over time you learn what are the facts that some people don't know that might, if you give them that information, that might help aid them in that decision and different things too.
So what do you do outside the clinic?
Yeah, so, right now with just having moved here, it's a lot of home renovation and spending time with my family. My parents and both of my sisters and their family live here. So I was the last one to make the return. I like to do a lot of reading. I paint.
So your parents were afraid you're going to move back in the basement at one point?
I think my parents would have liked that.
Oh, really?
That was my fear.
Okay, all right. So, I would live in my grandma's basement if I could, but my wife and kids don't.
Yeah, that might be a tight squeeze.
Well, hey, thanks for coming by. I really enjoyed talking to you, and I look forward to working with you and maybe collaboratively on patients. Once again, this was Jessica Thomas, a physician assistant at UnityPoint Clinic Family Medicine, Hiawatha. If you're interested in scheduling an appointment with Jessica, call UnityPoint Clinic Family Medicine, Hiawatha at 319-362-0200. 319-362-0200. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.